Hey guys, happy Thursday. I am signing in for what I think should be my last update for you guys. If you caught it in the heading, I've got some big news. But I want to start off with saying happy birthday to Rick's sister, Amanda. Happy birthday. What a weird time for those of us who have March birthdays to be having birthdays right now. So happy birthday, Amanda. I know lots of people are just finding me, so if you're just finding these videos, I've seen people just continuing to ask questions that were answered in the very first one or two videos. So if you're just finding me, please just go back. I know it's scary to see like 11 videos here now, but just go back to the first, watch number 1 and the FAQ video, which is number 2, and it should answer like 90% of the questions that people are asking. And then if by then you're wanting to still follow along on the journey, you can do that. My friends Mike and Jen up in Maryland sent me a photo yesterday. They were watching it on the big screen, so you can pretend you're binge watching some other, great documentary or day in the life type program. But anyway, so if you'll just go back and watch those, I know that your questions will be answered. So thanks again to all the people who are tagging me and sharing the videos with other people in your life. I know that they really appreciate it. I just see people now asking the question online of their friends and family if anyone knows anyone with COVID, and so I'm getting tagged in a lot of those posts. So people are really trying to still put a face with this with this cootie bug as it's spreading around. So thanks again for just continuing to share the videos. I know that people are still messaging me about how helpful that they have been to them, and so I really appreciate that. One of my colleagues hosts a radio show weekly on, he's up in New York, Reggie, and I'm going to be on with him as well as a panel of experts on Sunday night. So if there's a way for you guys to listen, I will just share that in a post so that you know how you can listen in if you want to listen in to the radio program. That'll be Sunday night, and I think he said 6 p.m. Eastern time. Excuse me. So the big news, the new news, Josh broke up with me today. So Josh is our epidemiologist at the Metro Public Health Department, and he has been just fabulous through this whole thing, as you can imagine. Since Rick was number 2 in the county, we have been in touch with him since the very beginning. Hey, Evan, War Eagle. Hey, Kim. Yes, praise Dolly that he has cut me loose today. So anyway, Josh has been our contact from the very beginning and has been tracking our progress. And he even apologized to Rick that this new guidance just came out after Rick was having to stay, stay out of contact for 14 days. Although Rick hadn't felt like going anywhere until the last couple of days. So anyway, I wanted to share with you guys the new guidance that we have. The new guidance was just released yesterday. It seems we're getting these updates on Wednesdays or Thursdays when there's new guidance out there. And they are asking for 7 days of self-isolation after illness. So as long as you don't have a fever for the previous 72 hours. And of course, no like weird symptoms. If you're still having night sweats and stuff like that, I would highly recommend you just continue to stay at home. But anyway, so that's the new guidance, 7 days of self-isolation as long as you don't have a fever the previous 72 hours. So what Josh was telling me is that there are lots of people who really have been, have had even how... Goodness. There are people who've had even milder symptoms than we have had, or specifically than I have had. And so, they've really felt bad for those folks who've had to stay home if they had things that they need to do. So, it is important to note that they still have that 14-day self-quarantine or self-isolation for people who have had exposure, because it does take a while for the cooties to percolate. So people like my friend Kim, who is now internet famous just by her name alone, they're still being monitored and tracked because they could be out, spreading their cooties previous to that. You know what I'm saying? If they never have the symptoms, then good for them. But if they do, they could still be spreading it. And as I understand, they might still be a carrier, even if they don't ever even really show something that they consider is that they're sick. So really good to know. And I don't know where we would go. People are like, is this going to be good for you? everything's shut down now, so it really doesn't matter, I guess. But it is nice to know that we don't have to be keeping such distance from everybody, and especially since we don't have any risk of catching this again, or at least that's not our concern. So I do want to do another plug. If there are folks who are watching who have had this illness or are experiencing it now, just a reminder that the Vanderbilt University is doing a study for immunity to the coronavirus SARS-CoV-2. I actually have put everything in the description here for this video for that, but if you want more information, it's just info@vvcenter.org or 615-936-5758, and they will work with you to arrange for collecting a small donation of blood, and that will just continue to help the research that they're doing to develop treatments and hopefully a vaccine. I've seen lots of posts today about blood type. So I don't know how many people have sent me the article that was about blood type and have just been curious what our blood type is. My blood type is B positive, so I'm not one of the ones that's mentioned. Rick does not know his blood type. He was digging through his medical records online to see if he could find out that information, and so we don't know. If we find out about that, it will be curious just to compare that to the article. So now that I'm all clear, I don't really see any reason to keep doing these videos. Again, the kinds of questions that folks are coming up with are just kind of miscellaneous, or they're getting into things that really are medical questions. And we don't have any extra information. We're just lay people. We are not medical professionals. So I won't be addressing questions like that. And I've had a couple of questions about opinions, things like, what do you think about everything shutting down? I understand the way that disease spreads. So it is what it is. And I don't really have an opinion on that, except for that I would like to see things slowing down just as much as anyone else is, because our healthcare system, cannot handle a very tall curve, as we've seen in all of the pictures and images that are floating around. So I am a fan of keeping the stress levels low for my friends who are in the healthcare delivery system, because if you really think about that, those people have families at home too, and they're also worried for their own personal welfare and safety. So just keeping those numbers as low as possible, even if that means we're dealing with this for a longer period of time, it just makes good sense. So anyway, just that is all I will say about that. I will say, for those of you who have followed me through my profile, that is totally fine, and you can feel free to follow me if you haven't already. And if anything comes up in the future that we will that we have an update on, I'll be happy to come back on and do a video, or you might see a post or something like that. But it's totally fine. You don't have to feel like you need to go and unfollow me for some reason, just in case you're afraid of missing something. And if you really can't get enough of me, I do have a YouTube channel talking about naturally curly hair, so you can find me over on YouTube. I have added the link also in the description. I'm Southern Curl Tara on YouTube, and we'll be adding some travel vlogs in the future. So for those of you who have suggested that maybe we should do some vlogging, or that I should do some vlogging, just know that it has really been on the to-do list for a long time. So the curly hair thing was the first thing that really inspired me to start to document some of the stuff that was going on in my life. My travel mate Kara and I did some videos just for our friends and family on our recent trip to Iceland, and we had a really great response with those. So our intention is that we get a little bit more order to some of that, and that we're able to share some of our travel adventures with folks. So you can stay tuned to that. That's also a good reason to stick with the follow. And let's see what else. Gosh, that's it. Thank you guys so much for your support. Everybody say hi to Kim. Kim, be like Kim. Kim's awesome. Kim is on. So thanks again so much for your support. Check on your friends and neighbors. While I know people are still afraid of getting out and about, and just see if there's anything that they need that you can drop off at their doorstep or what have you during this time. I just spoke with one of my dear friends who has been sick and is just at home kind of by herself, and she said, oh, it's just been so nice to talk to somebody else besides the dog. So think about kicking it old old school and giving a call to people on the phone and just checking in and seeing how they're doing. I know I've appreciated that. Don't forget to support your small businesses and complete the census. So thanks again so much, everybody, for your support through all this. You guys have been amazing. And again, I just appreciate all the sharing and all of the positive comments that you've given me. I know that it has helped to know that I've done something to be able to help in this time when we all feel a little bit helpless. So Willie did get a little screen time, but he's only wanting to show you his bum. There he is. Isn't he the cutest ever? I know. Willie needs his own channel. Bronwyn, can we see all of Willie? I'm like, yes. He is usually like literally up in my face when I'm doing any kind of video, or if I'm talking on a video conference for work. So again, thank you guys so much. I hope you have an amazing rest of your week, and we'll talk to you later. Thanks again. Bye.